Dental panoramic radiographs are essential tools in oral health assessment, offering a comprehensive view of dental and maxillofacial structures in a single, low-dose image. However, interpreting these images can be challenging due to overlapping anatomy and geometric distortions. Recent advances in artificial intelligence, especially deep learning, have begun to address these challenges by automating detection and interpretation tasks. This scene introduces the transformative potential of AI in panoramic radiography, setting the stage for a deep dive into its applications, performance, and integration in clinical workflows. Panoramic radiography, also known as orthopantomogram, OPG, is a tomographic imaging technique that captures the entire maxillomandibular region. Unlike intraoral X-rays, OPGs use synchronized movements of an X-ray tube and sensor around the patient's head, creating a focal trough, a curved zone that matches the jaw's shape. Structures within this trough appear sharp, while those outside are blurred or distorted. The technique's unique beam characteristics and rotation path allow for broad anatomical coverage, making it invaluable for initial treatment planning and triage, especially in patients unable to tolerate intraoral imaging. Panoramic radiographs are prone to three main types of artifacts: real images, double images, and ghost images. Real images represent true anatomical locations. Double images occur when midline structures are scanned twice, and ghost images result from dense objects outside the focal trough. These artifacts, along with low spatial resolution and non-uniform magnification, limit the diagnostic precision of OPGs. Additionally, proper patient positioning is critical. Even slight deviations can significantly degrade image quality, making accurate interpretation more difficult. Conventional manual interpretation of OPGs faces several challenges: anatomical ghosting, satisfaction of search bias, inter-observer variability, and clinical volume crisis. Human readers often miss subtle pathologies due to fatigue or cognitive biases. AI, powered by convolutional neural networks, offers a solution by automating object detection, tooth numbering, microspatial measurements, and early pathology identification. AI's ability to overlay color-coded findings on radiographs enhances patient communication and acceptance, transforming subjective recommendations into evidence-based decisions. Artificial intelligence is revolutionizing dental radiology by shifting from subjective human interpretation to data-driven computer vision. By analyzing large datasets, AI systems can identify subtle radiographic patterns and anatomical landmarks. Deep learning, especially convolutional neural networks, CNNs, forms the backbone of these systems, enabling early caries detection, bone density assessment, and periodontal evaluation. Regulatory bodies like the FDA are increasingly approving AI algorithms for dental imaging, reflecting their growing clinical relevance. Dental AI platforms primarily use deep learning architectures such as CNNs for image analysis and RNNs for sequential data. CNNs excel at processing static images, identifying features like edges and textures, while RNNs monitor disease progression over time. Advanced algorithms also segment 3D CBCT datasets, isolating anatomical structures for surgical planning. These architectures enable AI to perform tasks ranging from caries detection to implant planning, expanding the scope of dental radiology. AI systems are applied across various dental imaging modalities, including intraoral, panoramic, cephalometric, and CBCT scans. They detect pathologies such as caries, periapical lesions, and calculus, automate periodontal assessments, assist in orthodontic planning, and support surgical workflows. Automated charting and restoration detection streamline clinical documentation, while AI's high sensitivity and specificity improve diagnostic accuracy and patient outcomes. Recent studies show that AI-assisted clinicians achieve higher disease detection rates, up to 37% more than those without AI support. Diagnostic accuracies approach 92.3% for multiple pathologies, with tooth-level accuracy ranging from 94.9% to 99.9%. However, achieving perfect full-mouth diagnostic matches remains challenging, underscoring the continued need for human oversight. Regulatory-approved platforms like Pearl, Overjet, DiagnoCat, and Orchid Dental AI are already integrated into clinical practice, demonstrating robust performance. AI interpretation of panoramic radiographs involves a multi-tiered pipeline. First, object detection models like YOLOV8 or Mask-RCNN isolate regions of interest and number teeth. Next, semantic segmentation networks such as UNet classify pixels into anatomical and pathological categories. Finally, contextual filtering using RNNs refines outputs and removes artifacts. Synthetic data fusion ensures balanced training, reducing errors from image quality variations. This pipeline enables autonomous landmark mapping and pathology detection across the maxillofacial region. AI systems autonomously map anatomical landmarks and pathologies on panoramic radiographs. For periodontitis, AI measures the distance between the cemento-enamel junction, CEJ, and alveolar bone crest, quantifying bone loss and classifying its type. In implant planning, AI traces the mandibular canal and mental foramen, alerting clinicians to nerve proximity risks. For caries and periapical lesions, AI detects subtle radiolucencies and calculates lesion depth, achieving high diagnostic accuracy. These capabilities streamline diagnosis and enhance patient safety. AI algorithms are trained to detect a wide array of dental and maxillofacial conditions on panoramic radiographs. They excel in anatomical identification, pathology detection, and treatment feature recognition. Automated tooth numbering achieves up to 97% accuracy, while pathology detection for caries, periodontitis, and periapical lesions reaches near-perfect sensitivity and specificity. AI also identifies dental treatments such as crowns, pontics, and fillings, supporting forensic and treatment planning needs. Panoramic radiographs capture more than just dental structures. AI can screen for systemic conditions such as osteoporosis, maxillary sinusitis, and carotid artery calcifications. By analyzing mandibular cortical shape and sinus opacities, AI models achieve high accuracy in identifying these conditions, expanding the clinical utility of dental imaging beyond oral health. Integrating AI into clinical practice significantly reduces interpretation time and enhances diagnostic consistency. Automated charting and structured reports allow clinicians to focus on patient care and treatment planning. AI serves as a reliable second opinion, mitigating human error and fatigue. However, the gap between tooth-level and patient-level accuracy persists, with errors often linked to fillings and endodontic treatments in complex regions. Meta-analyses show AI models can achieve high diagnostic accuracy, often exceeding 95% for specific tasks. AI's sensitivity in detecting abnormalities sometimes surpasses human radiologists, but specificity remains a challenge, with AI prone to false positives. Generative AI models, while promising, currently perform comparably to non-expert physicians and require further refinement for expert-level accuracy. These metrics highlight both the strengths and limitations of AI in clinical diagnostics. Comparing AI with human interpretation reveals distinct strengths and weaknesses. AI excels in speed, sensitivity, and consistency, processing vast volumes of images without fatigue. However, humans outperform AI in specificity, contextual synthesis, and handling complex cases with multiple overlapping findings. The interaction between AI and clinicians is nuanced. While some benefit from AI assistance, others may experience reduced accuracy due to automation bias or poor quality AI tools. AI technologies, including machine learning and natural language processing, have revolutionized clinical decision support systems, CDSS. These systems process patient data, recognize patterns, and provide actionable insights. AI can be integrated at multiple touchpoints in the radiology workflow, from image acquisition to reporting and storage. Interoperability standards like DICOM and HL7 are crucial for seamless integration across diverse healthcare systems. Integrating AI into radiology workflows presents technical, operational, and regulatory challenges. Robust computational infrastructure, development environments, and clinical system integration are essential. Operational hurdles include strategic planning, staff education, and managing multiple AI tools. Regulatory challenges involve obtaining FDA clearance and ensuring ethical, clinically valid AI solutions. Continuous monitoring and post-production evaluation are necessary for safe and effective AI deployment. AI in radiography faces foundational challenges, including data quality, explainability, and reproducibility. High-quality annotated datasets are labor-intensive to produce, and public datasets often lack sufficient diversity. The black box nature of deep learning models limits clinical trust, as clinicians require transparent reasoning for diagnoses. Methodological instability means AI models may perform well in research but struggle in real-world clinical settings due to variability in data and equipment. The ethical landscape of AI in radiography revolves around beneficence, justice, transparency, and autonomy. Algorithmic bias can perpetuate healthcare disparities if training data is unrepresentative. The black box problem undermines trust and informed consent, while over-reliance on AI threatens professional autonomy. Legally, assigning liability for AI-driven errors is complex, involving clinicians, institutions, and developers. Data privacy is paramount, with regulations like GDPR and HIPAA requiring explicit patient consent and rigorous anonymization. AI deployment introduces new privacy risks, such as potential re-identification of anonymized images and data leakage through federated learning. Mitigation strategies include advanced de-identification techniques, privacy-preserving technologies like federated learning and differential privacy, and continuous security audits. Ensuring robust data governance is essential for protecting patient information and maintaining trust in AI-driven healthcare. Artificial intelligence is poised to transform diagnostic imaging, moving toward predictive analytics, workflow optimization, and multimodal data integration. Explainable AI will bridge the gap between black box models and clinical accountability, while automated reporting will streamline radiology workflows. Despite challenges, AI's role as a powerful adjunct to human clinicians is clear. The future lies in synergistic integration, with ongoing research focusing on seamless software adoption, longitudinal validation, and international standards for data sharing and evaluation.